Hey there YouTube, Dr. Steve coming to you for week 2 of the CrossFit Open. We're talking about recovery this year, and I think one of the things that we can work on for 17.2 is exploring vibration therapy for recovery from this workout. We're going to be burning up a lot of shoulders, it seems like this time, so I think that showing you kind of how vibration therapy works and then giving you some options would be good. So in my clinic, what I use for vibration therapy is this rapid release tool. It has a nice wide head on there and a couple of different treatment heads, but when we turn it on, it creates a nice vibration movement through here. So what I'll do with this, when people have soreness, things like that, is to go over any of the areas for about 1 minute to 2 minutes, working through any areas that feel a little bit tight, and then moving on to the next one. You probably don't have access to one of these, but the next best thing is going to be using a car buffer of some sort. So if you go on Amazon and pick one of those things up, then you can get one for, I think, anywhere between like $20 to $35. What I would recommend is one of the smaller ones. They sell ones that have like a 6-inch head, and that will allow you to kind of hold on and work on yourself with different things. Some considerations with vibration therapy is to make sure that if you don't have clothing over the area that you're working on, is to put a towel over the top of it and then kind of work over the top of that so that it doesn't irritate the skin too much. Muscle groups that I would focus on for 17.2 are going to be kind of the distal quad in here, and the medial side of the knee from those lunges is probably going to cause a little bit of stress in there, as well as working on the lateral hip. So anywhere from the front that you can kind of put your hand back here, anywhere that you can touch with your fingers is one of those areas that you're probably going to want to try and hit for that vibration therapy, just kind of working your way in through there. I wouldn't spend any more than maybe 2 minutes at a time in any one spot, and then move on to the next one. Other areas that we want to consider for this is going to be the lat in through here, because we're going to get a lot of strain in through there, and then just this whole shoulder region. So what you can do is just use that buffer to get through and kind of work things out. The reason that vibration therapy works is it helps stimulate the nerves kind of deep down and will help with muscle relaxation. There are some studies that suggest that it increases oxygenation of muscle, which is what we kind of need for recovery from anything from there. So give the vibration therapy a try. If you haven't already, I would say, it only costs you $20 to go pick up a buffer. It's pretty easy to do. Spend, like I said, no more than about 2 minutes in any area. Avoid any areas that are causing any numbness or radiating pain or anything like that, but just kind of go over each one, and you can use that in the future for anything else too. So that is my tip for 17.2 vibration therapy. So get yourself a buffer and get working. Good luck.